Birth control pills are a type of hormonal contraception that are taken orally by women. They contain two important hormones, a progestin and estrogen. These hormones work together to prevent pregnancy in a few ways. Suppressing ovulation. The hormones in birth control pills prevent the ovaries from releasing an egg each month. Without an egg, pregnancy cannot occur. Thickening cervical mucus. The hormones in birth control pills thicken the mucus that is produced by the cervix. This makes it more difficult for sperm to travel through the cervix and reach an egg. Birth control pills are a very effective form of contraception when taken correctly. They are over 99% effective at preventing pregnancy when taken every day as directed. Here are the basic steps on how to use birth control pills. Take your pill at the same time every day. This will help to keep your hormone levels stable and ensure that you are protected from pregnancy. Swallow your pill whole with water. Do not chew or crush the pill. If you miss a pill, take it as soon as you remember. If it is too late in the day to take your missed pill, skip it and take your next pill at the usual time. If you miss 2 or more pills in a row, you may not be protected from pregnancy. Use a backup method of birth control, such as condoms, for the next 7 days. If you vomit within 2 hours of taking your pill, take another pill as soon as possible. If you have diarrhea, you may not be absorbing the hormones in your pill as well. Use a backup method of birth control for the next 7 days. Birth control pills disconnect stress response in women. Social activities reduce stress hormones levels in women who don't use oral contraceptives. However, it has no effect on women who use them. The corresponding study was published in Clinical Epigenetics. Studies show that women who use oral contraceptives have an increased risk of cardiovascular, metabolic, and mental health disorders compared to women who don't use the drugs. A growing body of research also suggests that contraceptive use influences behavior. For example, the drugs have been linked to reduced perseverance and performance on cognitive tasks, changes in partner preference, and lower relationship satisfaction. Understanding more about how oral contraceptives affect the body beyond reproductive health could inform clinical guidelines and family planning options. Recently, researchers examined how oral contraceptives affect the stress response in young women. To do so, they recruited 131 women at an average age of 20.5 years old, including 48 who used contraceptives and 83 who did not. For the study, the participants were initially asked to fill in questionnaires providing information on their demographics, closeness with others, and mood. They also provided a blood sample. Soon after, they were randomly assigned into groups of 4 and asked to engage in 15 minutes of interactive activities, including non-competitive board games, singing, and sharing stories to foster interpersonal attachment and alleviate stress. After this, they once again filled in questionnaires detailing their closeness to others and their mood. They also provided another blood sample. From the blood samples, the researchers were able to assess levels of adrenocorticotropic hormone, ACTH, a hormone that regulates the production of stress hormone, cortisol. Ultimately, the researchers found that socializing reduced ACTH levels among women who did not use contraceptives during certain phases of their menstrual cycle. They noted, however, that socializing produced little to no effect in women who used oral contraceptives. The researchers noted that there are several competing hypotheses that may explain the differing effects. One possible explanation, they noted, is that oral contraceptives suppress the body's production of progesterone. Progesterone breaks down into the hormone allopregnanolone, which can influence the stress response and is known to have calming effects. By reducing progesterone levels, oral contraceptives lower allopregnanolone levels, which in turn disconnects the stress response and disables it from adapting to different situations. The researchers additionally found that socializing increased closeness and improved mood both among women who used contraceptives and those who did not, regardless of where they were in their menstrual cycle. While the findings shed light on some potential effects of oral contraceptives, the study has some limitations. In particular, the researchers noted that they lacked information detailing the duration and type of oral contraceptives used by the participants. They added that assessing other stress biomarkers, such as cortisol, may provide a more complete picture of how oral contraceptives affect the stress response. Lastly, they wrote that their sample primarily included young, Caucasian, college-aged students, meaning that their findings might not apply to more diverse populations. The most common side effects of birth control pills are spotting or breakthrough bleeding. This is vaginal bleeding that occurs between menstrual periods. It is more common with progestin-only pills. Nausea. This is more common in the first few weeks of taking birth control pills. Breast tenderness. This is also more common in the first few weeks of taking birth control pills. Headaches. These can occur at any time while taking birth control pills. Weight gain. Some women experience weight gain while taking birth control pills. However, the amount of weight gain is usually very small. Mood changes. Some women experience mood changes while taking birth control pills. These changes can include depression, anxiety, and irritability. Decreased sex drive. This is a rare side effect of birth control pills. It is important to note that not everyone who takes birth control pills will experience side effects. The severity of side effects also varies from person to person. If you experience any side effects that are bothersome or do not go away after a few months, talk to your doctor. We hope this video has provided valuable insights into the relationship between birth control pills and the stress response in women. Don't forget to like, share, and subscribe to our channel for more informative content. Thank you for watching.